Hi, everyone. I'm Kara Sheehan.
Thank you, Kara. That was your cue. And this is Medicare for All, the podcast for everyone who needs health care. And I am a little bit sad today because my regular co host is not with us, unfortunately. Ben is off saving the environment with his 9 to 5 gig at Friends of the Earth. But we do have someone who is filling in for him who is, I don't know, I'll insult Ben and say, even better. Um,
Or Ben.
Poor Ben. No, but who could be better than Kara Sheehan? That is my question. So, Kara, you are the political director for the National Nurses United, the largest nurses united in the country, the largest nurses union in the country. I promise I timed it so that my Adderall would kick in like midway through this interview. Um, and you were also a former Texan, which I love. So anyway, before we launch into some of the week's news and everything, why don't you just tell our folks a little bit about who you are? What does a political director of a union do? Why are you doing it, et cetera, et cetera?
Yeah, great questions. Well, yeah, I'm so excited to join you, Jillian. It's just like such a pleasure to be in the fight for Medicare for All with you. And I've been in
Hmm.
the labor movement for a very long time. Pretty much decided in college that this was going to be, this was my home where I belonged, and I came across the National Nurses United, the Nurses Union in Texas, while I was canvassing for Bernie many, many, many years ago, and fell in
Aw.
love with their theory of change and the nurses themselves, and also the fact that they are just so core and a critical piece to the Medicare for All movement. And so I found my way into the professional side of National Nurses United. So now I'm on the political team. I'm political director, and really what I do is just make sure that our political program is representative of what our nurses mandate, which is Medicare for all, making sure that patients can get the care that they need without fear of cost.
Mm,
And
mm, mm.
many, many other things. So our nurses are incredible, and formed our union on the idea that we needed a single payer healthcare system. And so everything that we do really revolves around that, including our political work. So I'm very blessed to get to carry that on and make our nurses voices heard in the political world.
Don't you just feel lucky that you get to be like fighting on the right side of history every day? It's pretty kind of cool, actually.
Yeah,
Uh,
great though. We are on the right side.
so wait, so people hear all the time though that unions are involved in politics, and I think that like a lot of folks don't have a really clear picture in their head of what that looks like, right?
Yeah.
So we're going to be talking later on about the shadow hearing that National Nurses United and the National Coalition for Medicare for All, of which Healthcare Now is a part, created this amazing shadow hearing, which was an event in DC with our partners in Congress. But just in general, like what does it look like when a union gets politically involved?
Yeah, I mean, I think at its core is just that we recognize that worker power is essential in sort of all the places where, whether it's on the political level, whether it's the economic level, whether it's,
Mhm,
on the
mhm.
shop floor organizing, it's critically important to make sure that workers' voices but also are heard, but also that we are building power that is centered and led by workers themselves. And so, it's of course just seems along that lines like inevitable that nurses would see the connection between what they're experiencing on the shop floor, which means,
Mhm,
their hospital
mhm.
CEOs are the ones who are giving money to politicians who pass
Right.
legislation that chips away at their rights. The insurance companies that cover their patients are, the ones who are maintaining a system that is totally profit driven and keeps their patients from being able to seek the care that they need. And so all those through lines are very, very clear. And so, our nurses from the very beginning understood that to have a really strong political program was going to be key to a transformative change. So can't
Yeah,
have single
yeah.
payer if we don't really, really get involved in the political world, which could be anything from, endorsing a candidate who supports Medicare for all to building a really strong, broad coalition of groups that are fighting for Medicare for all in DC and all over the country.
Yeah. I think, that's a beautiful thing. When the lobbyists from the healthcare industry show up at the congressman's office, right? They show up alone with
Mm-hmm.
a gross cigar and a wad of cash, right?
Mm-hmm. Mm-hmm.
And take him out to dinner, right? But when Kara shows up at the congressman's office, she brings a billion nurses with her,
Exactly.
a passel of nurses with her who can actually talk about their personal experiences and why this is such a critical issue. So I love that. That is fantastic. It's like having a lobbyist for people,
Yeah.
if such a thing existed.
Yeah.
Anyway, Kara has agreed to talk with me about some of the day's healthcare news happenings, as we do every episode on the podcast these days. So I wanted to just launch into that. But how's your week going so far, though, Kara? Are you
Oh,
doing okay?
I'm doing okay. We have this like weird spout of not hot weather in DC right now, so we actually get to go
Oh,
outside and like enjoy it. I got a tan line over the weekend. It's crazy.
oh.
Like actually being outside is great. How are you?
I'm doing okay. I am looking forward. This is Medicare's birthday this week.
Oh, so
We're
great.
having a little party.
She's turning 61.
She's turning 61. She's been pretty exclusive for a while, and
Hmm.
we're really
Hmm.
looking for her to open up the relationship.
That's right.
And get with maybe some of the other folks. We were very excited about the Medicare birthday. That always makes me happy. And just getting a little active, getting out there. I work at home alone, so I'm sitting in my office here talking to people a lot of the time. So it'll be nice to see the sky.
Yeah, love that for you.
Thanks, appreciate it. Anyway, so just some healthcare news. What's going on in healthcare? So we unfortunately weren't able to record on Friday because we and I keep saying we because I messed up my computer. I messed up my computer. I installed the wrong program and I could not record on Friday. But that means that we have even more up to the minute news for you. So, first important piece of healthcare news is about the health of someone in our government, and that is Senator Lindsey Graham. His health is not going so well.
No, I don't know if he even is considered having health anymore, right?
Morally speaking, he's healthier now.
Yes.
So Lindsey Graham is dead. I just actually wanted an opportunity to just say that on the air.
I haven't really got to say that either. Lindsey Graham is dead.
Lindsey Graham is
Wow.
dead.
He's dead.
All right,
Yeah.
everyone together. 1, 2, 3. Lindsey Graham is dead.
Is dead.
For those of you who aren't familiar with Lindsey Graham, where have you been? He is. He was a senator from South Carolina, and my most notable memory of him is as a war hawk. And a fetishist of death, who insisted that we should bomb as many people as possible in foreign countries, that we should serve the state of Israel politically, and that we should deny healthcare to as many people as possible by opposing the Affordable Care Act. That's just my picture. But am I missing something, Kara?
No, I mean, I think to sum it up is he's the reason why we can't have nice things. And by nice things, I mean basic needs like healthcare, housing. Good job.
Well, he's dead now. So I did want to mention, though, that I think it's interesting and ironic. One of the consequences of all the rolling back of the different subsidies from the ACA and all the major healthcare cuts that have been happening over the past year is that we see a larger number of people who are delaying healthcare because they can't afford it, right? This is like a really big and important statistic, particularly in places like Texas, where we actually have the highest percentage of people in the country who have stopped seeking healthcare because they just know they're not going to be able to afford it. And Lindsey Graham actually was feeling quite unwell before he went on Meet the Press. And someone, Axios quoted, a person asked him if he wanted to seek medical help. We don't know who that person is yet, but a person asked him if he wanted to seek medical help, and he said no, he would take care of it later, and then he died. So
Wow.
when we say that deferring healthcare, deferring access to healthcare does kill people, it's true. And Lindsey Graham proved it.
Yes. Yeah. I mean, so many people live that exact experience, although we know Lindsey Graham has incredible health insurance. And, you know, even if he wasn't a senator at that moment, he would have still had incredible health care.
Yeah.
Yeah. I mean, he definitely could have gotten care, but I think it is something to his macho personality where he wants to feel like he's stronger than everybody else. But at the end of the day, he still falls into the trap that we all do, which is that it's too expensive. It's too timely. We got too many things to do. Can't worry about our health.
Nope, absolutely not. So the man who has, who spent his entire career making sure that more people died is now dead. So that's a thing.
I think South Carolina deserves better. I'm sure. Did you see also the other senator whose name I wish not to say, but Senator Scott in South Carolina was also recently in the news because of how he treats his staff. You know,
yes.
It's just like, I know South Carolina people and they would not stand for that. They really do deserve better.
Yeah, for real. South Carolina is a beautiful place and it's worth fighting for. And I know that there are a lot of our friends on the ground right now who are scheming about how they're going to take back South Carolina. So
hell yeah.
Pretty exciting about that. All right. So our next piece of big healthcare news, though, Kara, is it's less exciting.
Okay, yeah.
I don't know how to talk about this without saying the words explosive diarrhea 7 times. And I don't want to get clipped on the internet saying explosive diarrhea. So I'm just going to call it, I was just going to call it ED.
ED, yeah.
But then it gets confused, though, with erectile dysfunction.
Oh, okay. So there's really no good way to talk about it.
No.
I mean, it's not good. Yeah.
I'm just going to call it the big D. The big D.
Much better, Jillian. Okay. Much better.
Great. I'm glad we talked about it. So there have been some outbreaks. There will be outbreaks. So specifically, we had a bunch of eggs that were recalled over the weekend, right? We've been having a big salmonella outbreak. I think it's about 1.6 million dozen eggs that were recalled.
And eggs are already too expensive.
Exactly. So now you're paying a lot of money for poison.
Right.
And that feels really unfair to me.
I agree. I mean, I think it's also just the amount of, we're getting different pieces of news every single day about what's really going on. And it's hard for somebody who is just trying to get by, take care of their family, go to work, to understand what's going on. You know, I think people are really scared too. It's like, even when I go to the grocery store, everyone is avoiding the lettuce line, you know? It's like,
right.
What do you do?
And of course, people are avoiding the lettuce line because in addition to the salmonella outbreak, we have the even bigger outbreak of cyclospora, which is, of course, a parasite, and has been traced. The current outbreak, which has so far gotten about 4,100 people, I think. Those are the confirmed cases now, as of yesterday, I believe. And so that is the big D. It gives you the big D. And it's been traced back to lettuce, but in a very vague and difficult to understand way.
Right.
Yeah, there's very little information. I actually, apologies for my use of AI, but I was sort of panicking a little bit. And I did go to my friend Chad GPT, and I said, what do you think about whether I should eat lettuce today?
What did he say?
He said, no. He said no.
If only we had like a trusted government institution that we could go to instead of ChatGPT to figure out what's going on, you know?
I mean, like, literally, it is so sad when your corporate chatbot is saying, like, Yeah, we really can't trust the CDC on this one. And
No.
of course, the reason we can't trust the CDC on this one is because there have been so many cuts
Hmm.
to the food safety and outbreak programs that are funded by the Food and Drug Administration and then also the Centers for Disease Control and Prevention. And so last year, the Trump administration cut the CDC's grants alone by 40%.
Mm-mm.
And that is about $5.8 billion as of May.
Holy shit.
So then those cuts get passed on to the states, right? And then the
Hmm.
states decide where they're going to do the cutting. And a lot of it has been done to, these different health officials who are in charge of making sure that our food is sanitary and that we can control outbreaks and stuff. Yeah, Michigan right now has the highest caseload. But you will note that one of the reasons why is because they successfully fought off their grant cuts in court. So
Mm.
they actually,
Oh, yeah. Hmm.
so one of the things that's going on here is that we're seeing higher reporting in states where they actually have preserved some of their health safety system. So
Fascinating.
you might like see that and be like, oh, it must be terrible to be in Michigan right now. But the fact is that they're getting higher reporting, whereas there's so many people here in Texas or in, Maryland or, anywhere else in the world, right, who are being, basically shortchanged and who are having this illness and not necessarily even getting tested for it. Of course, also the big D comes along with a lot of shame as well. So
Of
there are many
course.
people who have a little trouble, talking to the doctor about it. They'd rather just
Yes.
suffer alone than go into the doctor and say, hey, man, I've got the big D. Um,
You just don't
so
admit that. Yeah.
all of this, Kara, just reminds me so much of like my contact tracing days.
Yeah.
During the pandemic, I was a contact tracer for the state of Massachusetts, and they did a really amazing partnership with Partners in Health. So the Public Health Department in Massachusetts and Partners in Health created a contact tracing collaborative where we were actually calling people, and I think that we were one of the only states in the country that was doing this. We were calling people and we were not just telling them that they had COVID, and what to do about it. But
Right.
we were also actually interviewing them and doing deep interviews about what they had been doing the 2 weeks before they got sick and anyone they may have come in contact with, and then notifying those people, right? So it was a really robust program.
Mhm.
But the fact is that most states didn't even have that during the pandemic, and now that we're in quote unquote non-emergency times, kind of no one has that anymore. Anyway, it gave me like this kind of insight into the way that information flows during
Yeah.
outbreaks that I think is really interesting. You have to make sure that your local services are funded so that they can actually
Mm.
report this information to the federal government and then get the resources they need to treat it. So I
Yeah.
don't know. Yeah.
We need support and funding at all levels of government. I think we had really figured out some strategic and powerful ways to respond during COVID. And even, I was in Texas at that time, and
Mm.
a lot of county governments, stepped in when the state refused to in some instances. As we know, Governor Abbott was our governor at the time.
Yep.
And we're able to really put together some robust programs and also just get out ahead of, long-term health complications around COVID. And so it is, I think about in this moment where we're getting alerts every day about whether it's the big D or whether it's Ebola outbreaks in Africa, whether it's, all of these sort of
Measles. Yeah.
measles. Oh my God. Yeah. I mean, it's
Mm.
like, I think people didn't expect I think it was safe to just kind of think like, okay, we can cut this and like it can't be that bad. But it really was so quick how bad it got. Like, I mean, I thought it was going to take years before people would really feel
Yeah.
that what it would be like. And it's been just a little over a year, right?
Yeah,
Keeps them
no,
going.
no, it's really true. When I was a kid, my parents weren't big healthcare seekers, right?
Hmm.
And so they were, kind of, what doesn't kill you makes you stronger. Tough it out,
Yep.
whatever. Your body will do whatever to itself. I don't even know if the theory was that complicated. Just don't go to the doctor. And when I was about to head off to college, I started. I had this like terrible, what I thought was a terrible cold. It developed, and I was having these like crazy fever dreams all day, and my throat was swollen. Eventually, we went to the doctor and found out that I had scarlet fever, which
What?
which is what your strep throat can develop into if you don't get
Oh my
treatment.
God.
And
Wow.
like,
Okay.
I had only heard of scarlet fever from like Little House on the Prairie, right?
Correct.
Like,
Yeah. Oregon
so
Trail.
I guess like it just sort of it solidified in my mind pretty early on in my life that if you don't get healthcare, you're in the 19th century tomorrow.
Yes.
You
Yeah.
know,
Yeah. And we went back so fast. I mean, I'm
so
just,
fast. The
yeah.
measles. Oh my God, that was
Yeah.
gone.
Yeah. That took decades to get to where we were, which was still, we're continuing to build on the legacy of vaccine outreach and making sure that everyone had access to it. And then it just got cut. And instantly, almost instantly, we just
Yeah,
went back so far. It wasn't
yeah,
even just cuts, of course. I mean, we have people in really important positions spreading lies about what the power of vaccines and
yeah,
just
yeah.
public health in general, and really creating this idea that it's just about us, which I think is the hardest part and the most, but also the most beautiful part about Medicare for All is really shifting people's ideals about this is not
I see.
a
Yeah.
singular, it's not just about you, it's about the community that you live in, and it's about making sure that we are working together to be healthy and able to participate in society. And it's just,
Yeah, I
yeah.
see what you're saying, right? It's like it's not about you and what foods you choose to feed your
Mhm.
children. It's not about whether or not you choose to vaccinate your kids. It's about
Right.
a huge system, right, that's designed to fuck you over every turn.
Right. Yes. But you should vaccinate your children, of course.
Yeah. Oh, right. Yeah. 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 No, we're very, very pro vaccine here. Not the least of which because I am pretty immunocompromised and
Right.
I don't want your kid to get me sick. So do
Yeah.
that.
I mean, it's kind of scary to like be in big public spaces now. I'm like, when am I going to get sick? I don't know.
Yeah, can we get the measles? I don't know. Um, I don't think so. I think we've
These are
all been
questions. Yeah.
vaccinated. Yeah, we come from the before times. Um, speaking of big evil systems that are designed to oppress us, I don't even know if we were, but I'm talking to you, Kara, so I'm assuming we were talking about big evil systems that are trying
That's
to
right.
oppress us.
Hmm.
I couldn't have someone from a nurses union on without giving a shout out to my friends at the Mass Nurses Association, who I got to work with for many, many years. And
Love it.
they just had the largest nurses strike in Massachusetts history. It was about 4,500 nurses, and they did a one-day strike at Brigham and Women's Hospital in Boston. And they killed it. They did a really, really amazing job of standing strong, and they are fucking heroes because they've been fighting back on staffing issues, compensation, workplace conditions, and really, I think one of the things that I always appreciate about nurses unions in general is the fact that when nurses unions go on strike, they're never going on strike just for nurses. It's
That's right.
always because nurse working conditions are patient care conditions, right?
Yeah.
Absolutely.
Yeah. And it really is in moments when nurses go on strike, it's like so telling. I mean, we know this, you and I know this, how critical nurses are to just the functionality of the hospital itself, the ability for patients to receive timely care. I mean, they're just, without them, we wouldn't be able to really access, go into the hospital without a nurse and what happens, it's just, it's really just putting us in to like critically think about how important nurses are to receiving care day to day and to the making sure the hospital functions. And I
Yeah,
also
yeah.
think every time nurses go on strike, it becomes so clear on why the core issues that they're fighting for in their contract are what they're fighting for, right? It's like,
Yeah.
oh, staffing levels are at a critical level to the point where we're forcing nurses to take on a dangerous amount of patients at once. But you go on strike, and it's like there is not there already is not enough staff, and then now we're at levels that are at
Yeah.
critical. So it's really sending a message to hospital management. These are a vital part of the day to day of the hospital, but also to just make sure that they can't ignore how bad the staffing levels are in this manufactured crisis that they've created, where they just want to cut costs, cut nurses, and then it's the patients that suffer and the nurses who suffer.
Absolutely, right. And there have been all of these studies that have been done, by the way. This isn't just, a bunch of union people, spouting a bunch of communist worker garbage. There have been so many studies that have been done by public health professionals that have demonstrated that there is a cap on the number of nurses, the number of patients, right, that one healthcare provider can successfully cared for, right? And so nurses have just been, basically fighting for many, many years, right, to get these safe patient limits. In fact, they should have passed safe patient limits in Massachusetts back when we had the chance to do so on the ballot a few years back, and we wouldn't be in this position. So, but that being said, of course, the way that the company replies to this is never by saying, "Oh, wait, you're right. Nurses are really valuable to patient care. We should pay more attention to them." Instead, so these nurses went on a one-day strike, right? And they're so cautious. The nurses are always so cautious when they go on strike because they care most about their patients, right? And they want to make sure that the patients are taken care of. So they walk out, and then the hospital, locks them out for the next 4 days.
Classic.
I don't know. I mean, you and I have been working in the labor movement for a second, but I don't know if most people know what a lockout is. Do you want to give a rundown there?
Yeah, I mean, it's basically nurses will show up for their shift after going on strike, and there will be a group of people waiting outside the doors that basically tell them that they can't go in. It is, I think nurses prepare for this, right? They know they have to really think about the risks when it comes to taking a strike, but absolutely management pushes issues to the edge where it's really the only way to build power and really just be able to make it clear that to not just the hospital, but to everybody what is going on. I mean, there are so many reasons why that nurses take into consideration when they're thinking about striking. But then it's obviously a huge risk because inevitably the hospital then will try and lock them out and hire, not part-time nurses, but contract nurses from like a staffing agency and really just create a lot of chaos inside the hospital. And, when all they need to do is sit down and bargain in good faith with the nurses. But of course, they love to manufacture a crisis. They love to put it back on the nurses. They love to really just make things as hard as possible for just real progress.
Yeah, no, absolutely. Absolutely. And it's funny that you mentioned temporary staff because it's also funny how fucking predictable all of this is.
That's right. Yeah.
Like, honestly, like, I think that Kara and I could have sat down and with the folks at the Mass Nurses Association and really written down the history of what happened here over the past few weeks without even knowing anything about the dispute. This happens every time. Right. So basically what the hospital did during that 4-day lockout is that they replaced all of these experienced nurses with temporary staff. Right. And those temp nurses, of course, I mean, it's a scary thing for patients. And one of the things that's interesting here is that that kind of shows just how fucking hypocritical these hospitals are. Right. So yeah, it turns out the actual strike that the nurses took voluntarily was on July 8th. Right. So the nurses have voted to go on strike, and the strike is set to begin at 7 a.m. Right. And on that day, the employer walks in and refuses to let the NICU nurses, NICU being the, folks who deal with the most vulnerable babies in Massachusetts, basically.
Yeah.
And they refuse to let them leave and participate in the strike, right? And so it's, it's just so hypocritical, right? They're like, we don't think your staffing concerns are serious until the minute when you try to go on strike. And
Right.
then we're going to stop you from taking your legal right to strike because the staffing problems.
You can't take concerted activity. Yeah. I mean, thanks for making it clear what they have been saying over and over again, right? And it's the whole system is just really, I mean, the ability for a hospital employer to just call a staffing agency, which is also so unfair to the nurses themselves that are caught up in this, staffing agency of just.
Oh my gosh. Yeah.
Yeah. I mean, they're getting put in hospitals where, maybe they've never even set foot in. A lot of the nurses probably that, are on strike have been there for, years and years and years and really, have the relationships and the knowledge and just like the long-term sort of, the knowledge of being there long-term. And you're throwing nurses in there to just for a couple days and expecting them to just, probably work in conditions where they are forced to take care of too many patients in a hospital that they don't know. It's unfair all around.
Yeah, it is. It absolutely is. I do know that one of my good friends in the labor movement, though, she actually ended up getting involved with the labor movement because she was actually hired as a temp, not as a nurse, but a tech. Wow. And so she was hired as temp hospital staff during a strike, and she got there the day of, and she was like, "Wait, I'm a fucking scab?"
Right? I don't tell you. They don't tell you.
Right. So these
what a radicalizing moment, though.
Certainly was. Was. Now she's organized thousands of workers. I bet they wish they hadn't hired her as a temp. It is. Nurses' strikes are crazy. Terrible that nurses have to go on strike. But when they do choose to go on strike, they always do it in such a responsible and thoughtful way. And so I think that, it's really important to look to the nurses always, right? When we're thinking about like what's at the moral core of our political system and of our healthcare system.
100%. And those moments when nurses are taking action like that are so good for, people like us, the people that listen to your podcast, to just like, I mean, if it's in your hometown, you should absolutely go join the picket line and talk to the nurses.
Yes. Mm-hmm.
Follow along their social media. I mean, the thing is like hospital executives will be able to have a lot of control over the narrative and sort of like the media space, of course, like, and sort of like spew their own story about what's happening to maintain control and make sure they don't have to spend any more money. They don't want to sit down at the bargaining table, but at the end of the day, we have the real opportunity to go out on the picket line and talk to nurses to, hear firsthand those accounts and really understand what's going on. And I think the more that we can do that and make sure that the boss doesn't win in the narrative or, at the bargaining table. Yeah.
Absolutely. So, I mean, obviously one of the places that we're fighting is in the workplace, right? That's super critical. And we love the fact that the nurses on the ground are keeping that up. But another thing that we're doing, and specifically that you're doing, I'm just going to keep saying we and take a lot of credit.
Yeah. It's all of us. Yeah.
It's all of us. It's all of us together. Basically, we want to talk. One of the reasons that you came on the show today is because we want to talk a little bit about the shadow hearing that we had in Washington last week. So many of you might not know what a shadow hearing is. So I want to kind of just talk about it a little bit. So basically, like when the U.S. Congress wants to get together, they don't actually just check like the shared Google calendar for a time when nobody's using the House floor. So scheduling when or if a bill will ever get discussed or voted on is entirely up to the majority party. Of course, that's the Republicans right now. So these days, it basically means that if you're a lawmaker and you're outside of the MAGAverse, right, you can't do some pretty basic parts of your job, like holding hearings and literally just talking about important legislation, right? Mm-hmm. So our friends at the CPC, which is the alphabet soup for the Congressional Progressive Caucus, which is the legislators in our Congress who believe in like I don't know, justice, human dignity, whatever.
Right.
Yeah. So basically, they've responded with a series of kind of alternative hearings, which are called shadow hearings, right? It's like an unofficial hearing. And they're doing them on topics like healthcare, for example, like, just in general, like life or death stuff that Republicans just never seem to get around to talking about. And so Medicare for All actually got its turn in the shadows on July 22nd with a hearing that was hosted by Representatives Pramila Jayapal and Debbie Dingell. Much love to those ladies. So today we're going to get the report back from Kara on the hearing. Pretty exciting.
So exciting. Yeah, I mean, I think we see these moments when the Republicans have control in the past that, it seems like the Democratic Party is really quiet, and it is not without, now that we've seen like what it's like on the inside on the shadow hearing day, we really got to witness how hard they try to make it to make sure that nobody in the minority has even access to meeting rooms. They made it really hard for us to get through security. I mean, they do all these things to just really make sure that they can control the priorities of that congressional session. But, kudos to Pramila Jayapal and Debbie Dingell and the CPC chair, Greg Casar, for really making sure that, despite all the obstacles in the way that we would hold space for this critical issue, which is Medicare for All. And I will say, I mean, we're watching right now the Democratic Party and, anybody running for office, anybody in office right now, talk about what they're going to do to fix healthcare, right?
Yeah.
And it is a lot of conversation about trying to undo what the Trump administration has done, which we understand that he really bulldozed a lot of really important healthcare infrastructure. Like, that is critically important. But I think most people in the United States would say going back to what we have is not going to work for us. It never did. And so I think the CPC is doing a really great job of using these sorts of spaces to remind people that there is actually a proposal out there that millions and millions of people are behind, that would actually create a system that would benefit the patients who need care and the people providing care, our nurses and, healthcare providers. And that's Medicare for All. So it was like a good, we're really using this as a summer of Medicare for All. We continue to build on the momentum around it, but just making sure that these next critical years ahead of us, that this is back in people's minds, and we remind people why it is the best option out there and what we really need to fight for.
Yeah. Do you want to talk a little bit about like why now, right? Like the hearing was actually called Universal Healthcare. Now is the time for Medicare for All. And like for us, you and me, right? Like it's been past time for Medicare for All.
Yes.
Right? We came to that realization a little earlier. But so why do you think it was so important for the CPC to have this particular hearing on Medicare for All in this particular moment? And why, we're seeing this explosion of Medicare for All activities, right? Like what's going on in this moment?
Yeah, I mean, I think a lot of people in Congress, our elected reps, are really in the position of defense right now. I mean, I hate using the sports term of offense and defense, but it is true that they are trying to defend and keep the worst from happening.
Yeah.
And I think it's easy to get trapped in this, into this spiral of protecting when we really need to be thinking about what our party and what our representatives are going to offer as the, alternative and the solution. And so that, I think the CPC recognizes, is missing piece in the conversation right now. It is really about, ACA, Affordable Care Act. It's about Medicaid, all these critical programs that have been slashed and really impacted by the Trump administration. But it's a reminder that, like, as we were saying, is that going back is not an option, because it was always faulty. It was always messy. It was always, overly expensive, overly complicated. And insurance companies really get to run the show, and it has nothing to do with the providers, the nurses, and the patients. And so the CPC is really down with us in the Medicare for All coalition to recognize that we need to remind people, we have to remember what the bill is about. I think like we've had to spend 2 years really fighting to get our voices heard, to get people to really focus on Medicare for all. And so we've a lot of people inside Congress have lost time with that. And so we have to remind
Yeah.
people what the bill is. We have to remind people why it's a critical priority and also that it's winnable. I mean, I think this is what we run into all the time, right? Is people that keep telling us it's not possible, that this is not the moment. And rightly so, it was titled that this is the moment because why would we fight for anything else right now? I mean, why would we fight for a system that has failed us so much, that doesn't work? We know it doesn't work. Everyone, I think, could admit that it doesn't work, right?
Yeah.
And
Yeah. Yeah.
it's not like we're coming out of, coming out with this new brilliant idea. We have an idea that has been tried and tested. We have Medicare for all, a single payer health care system, and is exactly what would fix all of the problems that we face in our healthcare system.
Yeah, yeah, right, exactly. I think you're a little bit younger than I am.
Interesting.
Tiny bit. But like I just like I keep remembering like what it was like because I got involved during the ACA fight, right? So
Yep.
the Tea Party and the town halls and the whole
Yeah.
bit. I was there. But I can just remember at the time, that I learned a lot about healthcare policy, and I learned that obviously that single payer was the solution, right? That Medicare for all, we didn't even call it Medicare for all back in the day. Gather around, children. Let me tell you about the olden times.
The lore.
So I had this understanding that Medicare for all was the solution, and it was so quickly abandoned in the process. But I was pretty politically naive at the time, and so people told me, if you fight for the ACA now, that can be the pathway to Medicare for all later, right?
Yeah, pathway.
Now, do I regret fighting for the ACA? No, I do not.
Right.
It's awesome, right? I mean, people like Kara, who are like 23 years old,
I wish.
still on their parents' insurance. Kara's a little older than 23.
Yeah.
But my point is, people who are 26 years old and you're still on your parents' insurance, like, yes, I'm really happy you have that.
Yeah.
People who can get insurance without pre-existing conditions, I'm really happy for you. And I'm one of you, so I'm happy for myself too. But the point is that it turned out not to be a gateway drug to Medicare for all in the way that it was sort of promised, right? And in fact, the kind of corporate Democrats who insisted that we had to abandon the idea of Medicare for all at that time period, they stopped, right? They were ready to stop after the ACA, right? So that promise, like, we're going to carry this forward, just never happened. And so that can be like, you can read that as a kind of conflict within like the Democratic Party or the left or whatever. But you can also see how the way that we did healthcare reform during the ACA actually did not serve as a stepping stone, right? And we need to actually analyze why that is. And I think it's exactly what you said. I just want to uplift this. The insurance companies are still here and they are still running the show, right? The insurance companies are your toxic boyfriend who you need to get out of your life, you need to go no contact.
You can't survive without them. You can. Yeah.
Yeah, you absolutely can. You absolutely can, right? So I think that you're absolutely right that it's this issue of like, why would we fight for anything else, right?
Yeah, and I think, we've really been, and I also use we a lot in these conversations, but I do think that we have been sort of taught in our organizing spaces, well, I wouldn't say we in this scenario, but let's just consider it we for a second, is that that there is going to be bargaining that takes place, and we have to be ready for basically to bargain against ourselves, right? And I think that's not something that we carry forward in our organizing spaces, but I think a lot of people in elected office do, because it's hard as hell in there, and it's also like the amount of work it's going to take to get there is a lot, but I think they have to recognize that there are millions and millions of people outside of Congress who are ready to fight with them. They can't do it without us, right? And it's just, this happens every time when healthcare comes back up into the conversation, when we're going to make this massive reform, and people are so ready to just jump into the conversation already bargaining against themselves and not believing that anything is possible without the insurance companies. And we know that that's wrong. And we know that they have absolutely golden handcuffs on a lot of people inside Congress. And it's just, we can't do anything if they're there. And any sort of stepping stone, anything that's going to get us closer to Medicare for all has to be about sort of strangling the insurance companies and giving them less power. And then, I mean, we need to go all the way, of course, but if we do want to talk about stepping stones, it has to be a critical part of the conversation is how do we make sure that they don't have all the power anymore?
Yeah, absolutely. Absolutely. So I know that, that's actually one of the things that folks talked about the hearing, talks about at the actual shadow hearing. By the way, for folks, the idea of a shadow hearing, I know that it sounds kind of like a little bit like tantalizingly illicit. Yeah, like the shadow hearing, but it is really very much like a regular hearing. It's just off the clock. So don't imagine that this was happening in like a dark room somewhere. This was like a regular hearing. But you want to just so people, first of all, I want everyone to know that they can actually go to the CPC's socials online.
Yeah.
And they can, find the whole hearing and they can listen to the whole thing, and they definitely should. But for those who weren't there, can you give us some of the highlights? Like who was there? What was the vibe? What were they all wearing? No, you don't
love that. Yes.
Yeah. Mm-hmm. Any particularly compelling testimony you heard?
Yeah, I mean, the vibes were really high. We packed the room. I mean, we had more people than could fit into the room, in fact. And so we had our NNU nurses in their red scrubs in the audience. We had PNHP doctors with their white coats on. We had, really representation from all of the amazing partners in our coalition, including, members and organizers with People's Action. We had UAW in the room. We had Labor for a Single Payer and Public Citizen. And so it was just a really good showing, that a reminder, to the folks who were, I guess it was like really trying to take a risk to, get space in Congress to have this conversation, to really call on the Democratic leadership to, focus on Medicare for all, for all the elected officials who are up there, really trying to lead this conversation. It was a reminder that, again, there's so many people behind you. We're ready to fight. And everyone was just so excited to be there. And we had 4 people give testimony. And so that was Chelly Garcia from People's Action. She's based in Chicago. And she really told a story from a patient perspective. And then we had Dr. Diljit Singh, who is the president of PNHP, Physicians for National Health Plan. We had the amazing Jamie Brown, our president of National Nurses United, who's from Michigan.
Yay!
And then we had Egan Kemp from Public Citizen. And so everybody really was able to take a piece of, the system that we're trying to build with single payer Medicare for all system, but then also offer their perspective of what it's like right now to operate under our private insurance and profit-driven system. And we had a really good turnout from members of Congress who showed up. So, So, we had our bill sponsors, which are Debbie Dingell and Pramila Jayapal, who opened it up and grounded us. We had the chair of the CPC, Greg Kassar, and then they really had they had this long table in front that was, each seat was for a member of Congress, and they would switch people out. So people had turns to go up and ask questions. And every member that came had questions of their own. It was from union member, I have union members in my district who are worried that they're going to lose their bargain for health insurance plan. How do you talk to union members about this? So Jamie Brown was really able to center the conversation and respond to that in a way that I think gave members of Congress a lot of really good understanding of where union members really are in the conversation around Medicare for all. And that is that they support it, and that everybody wants good, decent health insurance. And also, how great would it be if we didn't have to bargain for health insurance coverage at the bargaining table? What if that was taken off the table, So it was just
surprise. That's what workers want.
Surprise. We could, have, bargain about other things. Yeah. So And yeah, it was a good opportunity for members of Congress to ask some of the questions that are like maybe keeping them from talking about Medicare for all the time. Maybe it's even
Uh,
keeping them from like signing onto the bill. You know, there were really good
sure.
questions out there that are the ones that we come across all the time. So of course we had really skilled people up in the front able to answer those questions and hopefully give
Including, I was just going to say, including our buddy Egan Kemp, friend of the show.
yes, friend of the
Uh,
show and genius, resident genius on the Medicare for All table.
yeah, absolutely. Absolutely. I really, really love watching him say smart things to not so smart people. Um,
Yes.
but in this case, he was talking to smart people. So that must have been even more exciting.
Yeah.
Um, so yeah, okay, this is super awesome. So you followed this up with a lobby day, right?
Yes.
And so you took nurses and doctors from Physicians for a National Health Program and union members from Labor for Single Payer and community organizers from public no from
People's
People's
action.
Action and policy experts from Public Citizen, et cetera, et cetera. And you took them all around the Capitol. So what'd you do? How'd that go?
Yeah, I mean that was every single part of the day was like high vibes, but I really feel like everyone loved being able to be in a group that was, you know, as a nurse member, nurse in a leadership position at NNU, our nurses got to go around with PNHP doctors and People's Action organizers, all all the groups that you named, and so it was like really getting to see the breadth and the depth of the expertise and the membership within our coalition. But I also think when we got to sit down with offices, it also just reminded them again of like how many people really are in this fight, and the different sort of expertise and stories that we are able to share and give them. And we spent a lot of time in offices with on the House side. So these were Democratic members who are not on the bill, who do run with a
Mm-hmm.
progressive agenda. And I mean, all the conversations were really, really fruitful and gave us an idea of, what some of the sticking points were, what it would take to move them. And so I just feel like it was really empowering to know that, like, we're offering up, we're coming into them as like a trusted source and people with really important expertise, but they're also giving us information to help, strengthen our fight and our efforts to get to move these people to get them on the bill. And on the Senate side, we met with almost all Senate Democrats that are members of the Senate Finance Committee, which would be a really, really critical committee once Medicare for All is actually moving through the Senate. And the ranking member is Wyden from Washington.
Uh-huh. Uh-huh.
And he has been sort of circulating and trying to like formulate healthcare plan of the future. And
Oh boy.
it, I'm sure you could guess it does not include Medicare for all. It
Hmm.
focuses on things that people care about, which is affordability and access. But there's only one way to really fix that. Again, it's like offering up little
Mm-hmm.
pieces to
Mm-hmm.
like fix the broken, put like little
Yeah.
pieces back in. Yeah.
So we actually know that his plan would widen the gap between people who can
Correct.
access care and people who can't.
That's
Um, that's I really wanted to say that. Okay. So this is great. And why is it important? Just because I think a lot of people spend time like trolling politicians online, which I do too. It's cool. It's
totally.
important for your mental health and also for the politicians.
Mm-hmm.
But why is it important to actually take these opportunities to go see them in person and like show up at their fucking front door?
Yeah, I mean, I think it's many reasons. It's like recognizing that we have power. I think like the big congressional building can feel like inaccessible, and obviously the Republicans in power try to do whatever they can to keep us out of the building. But if you call your office and you say, "Hey, I'm coming to DC with a big group of, people that are in the Medicare for All coalition and we want to sit down with the representative," you're probably actually going to get a meeting with the representative himself. Like I think that there is
Mm-mm.
at least some sort of understanding that people that live in your district, you have to respond to, and that gives you sort of an entry point to like but if we aren't in there moving them, who is in their ear, right? So it
Right.
could be that if that day they got a visit from a health insurance CEO, like a lobbyist for a health
Mm-hmm.
insurance
Mm-hmm.
company, and all these people are in their ear, and so we have to really offer up, um, the alternative. We have to show up. We have to let them know that we're there and we're watching, and we really believe in Medicare for all. And also in those meetings, we get really important information. As I said, it's like we know that
Yeah.
they're not going to sign onto the bill maybe in that one meeting, but they may have given us just like one little detail that will help us build a really campaign to pressure them to get on the
Mm-hmm.
bill. So
Mm-hmm. Mm-hmm.
it is total like inside outside game, but we get to build really great campaigns that, bring in more people in their district, that really get people to recognize their own power and organizing abilities. And so all of this goes, really as part of the puzzle to pass Medicare for all. It is not the only piece that we should worry about, but it is pretty high up there. It's an important one.
Yeah, no, absolutely. Absolutely. Like organizing the legislature is something that we don't really think about, but
Right.
is so, so critical. And there's something really powerful about standing there and like looking them in the eye. I think
Totally.
like one of my favorite lobby day experiences was we were fighting these anti-immigrant amendments to the Massachusetts state budget, and it was the campaign wasn't going anywhere. So these undocumented immigrant students decided to do a sit-in outside of the state house, and so we camped. I mean, they camped outside of the state house. I joined for quite a bit of it. I just really enjoy sleeping outside on the ground. But but anyway, so these undocumented students led this campaign. And one of the things that we did was we brought in a bunch of faith leaders, and we went and lobbied with undocumented students, faith leaders, and community members. And we went to each congressperson's office and we asked them to pray with us for justice for migrants.
Wow. Whoa. Give me like one reaction.
Well, I'll tell you, there was only one person who refused to do it and said, that's your thing. And like, oh no, that's your thing. That's for you. And I was like, oh, so migrant justice and moral center to our politics is for us and not for you.
People, it's not for you.
But every single other person
saying the quiet part out loud.
Exactly. So the people who were conservative enough that they didn't want, undocumented immigrants to get healthcare, which is, of course, it always comes back to healthcare. They were also too conservative to refuse a priest who said, "Hey, let's pray together." So, yeah. Anyway, my point is that staring them in the face, looking them in the face while saying, your point, it makes a big difference. We need to get in front of these folks whenever we can.
Totally. There's nothing more exciting than asking your representative face to face, why don't you support Medicare for all? And then just being really quiet and making them answer that.
I love the silence after the question. It's so good. Delicious. I know I'm taking up way too much of your time today, Kara. So I do want to wrap up in a second, but I just wanted to give a sec really, really quick. We are recording this live right now and it's going out over our socials. We got some comments are popping off in YouTube. Whoever, by the way, typed in BBW into the comments, I'm going to assume that one's for me. Big, beautiful woman. That's like the old timey, personal ad slang, like in search of BBW, whatever. Anyway, I just wanted to say, Rob J568, I see you and I feel seen. I'm sorry. Sorry, Kara. I was assuming that one was for me. So yes. So we're going live today. This is where I was at. We're going live today. And so for those who are listening live right now, they still have an opportunity to join us for that Medicare birthday party that I was talking about.
Oh my God, that's right.
So some of you are going to be listening to this once we actually put it out on the podcast platforms. And I'm sorry, you might have missed this event. But for now, for those who are actually on the, who are listening, why, Kara, do you want to talk a little bit about the deal with these Medicare birthday parties?
Oh my gosh, yes. Well, this is just another piece of our summer of Medicare for All. And as we know, our movement has to include joy and celebration. And our girl Medicare is turning 61. We'd mentioned her at the beginning.
Mm-hmm.
And so Lyndon B. Johnson signed Medicare into law in 1965. Every year, I think the Medicare for All movement really takes this as a moment to remember what it took to get to that point, which, in 1965, it was super radical to really push for a program that would guarantee health
Yeah.
for seniors. It was so radical. And a lot of the talking points and pushback from private insurance companies, from their supporters, the people that they support in Congress, are very similar to what we hear today. And so it's a reminder of the movement that it took to get to that point. We can take a moment on Medicare's birthday tomorrow to really look back and look at some of the stories, look at who was really leading that moment, remembering how big and broad the movement was, and really take that spirit with us into this fight for Medicare for All, because we're really building off of that legacy, and we're ensuring that Medicare is strengthened, expanded, and covers everybody, young and old. And this will be a really fun opportunity to join grassroots-led birthday celebration. So there's a map. Jillian, you probably have it, but we could drop it in the chat.
Yeah. I can make sure it goes in the show notes for sure.
Okay, great.
Yeah.
And go find, if you have a Medicare birthday celebration near you, and join it tomorrow. I know there's one in DC that starts at 11 that I will be at. And people are bringing cupcakes, people are bringing cards, people are going to go lobby their legislators after for our particular one. But yeah, the birthday parties will just be a really good moment to remember and prepare for the work ahead.
So exciting. Excellent. So we will be celebrating. We'll also be celebrating here in Corpus Christi, which is very
Amazing.
exciting. And we're going to be talking about the civil rights movement and the legacy of the civil rights movement in Texas. LBJ, who,
Classic Texan.
Classic Texan, very much so. Yes, absolutely. I went to the ranch
Okay.
like last week. Yeah, absolutely. It was like, hey, the chant at the time was like, hey, LBJ, how many kids did you kill today? Because he was
Wow.
really bad on Vietnam.
Holy shit, yeah.
But now, I don't know, the way that I'm thinking about it is like, hey, LBJ, Vietnam was very bad, but Medicare was okay.
Okay. I like that. Yeah. We don't forgive you for that first thing, but
no forgiveness.
Nope.
But anyway, this is very exciting. We're going to be, like I said, we're going to be talking about it in Corpus Christi. Folks are going to be talking about it around the country. We'll drop the link wherever we can. And yeah, pretty exciting. Thank you so much for being here, Kara. This has been such a lovely time.
Yeah, thanks for having me.
You're really giving Ben a run for his money. So
tag me in whenever you need to.
I love that. I absolutely love that. All right. So before we leave, I want to thank our podcast team, especially our audio editor, Craig Stanton. And also, I would like to remind you all that you should like, subscribe, comment, and share with your friends. And this podcast is a project of the Healthcare Now Education Fund. You can support the pod by going to www.healthcare-now.org and click on the donate tab to send us some love. I say the same thing every episode and I stumble every time. So please come back next time to hear me, fuck things up some more. All right, folks. Thank you so much to Kara. Everybody, stay safe, stay dangerous, avoid lettuce. We will talk to you very soon. Thank you. Okay, I'm going to be honest at this point that I'm having trouble ending.